bit after 11:20 Eastern Standard Time. And this is the BlackAnthropy Show, where our mission is to shine a black light on people, nonprofit organizations, for profit entities, and entrepreneurs who are impacting the community, individual, individuals, and families by providing knowledge, resources, opportunities, and inspiration. And this morning we have a guest who is checking all of those boxes. My guest this morning is Miss Malak King. She is manager of community health worker and community pathway hubs. Through this program, she teaches a lot of different people are getting into the community health worker program. This is a very important up and coming profession, and you can get a job very quickly after taking a very using a short amount of time to enroll in some classes that give you the knowledge and a practical experience to go out and help your community. Please welcome my guest this morning, Miss Malek King. Please. So, Malek, please start out by telling us what you do as a manager of community health workers and the community pathway program.
Good morning, everyone. My job is twofold. The first is I'm the program administrator for the actual community health worker training program. So that's where an individual would come through our program at Tri-C Cuyahoga Community College and become a community health worker. The other piece is actually being a part of the Pathways Hub program, and that is a nationwide um, way in which data is collected in regions. So we're part of the Northeast Ohio region under Better Health Partnerships. They are the hub. That's where all of the data is located through a secure portal, and they are the ones that look at that information and they determine if there are any patterns that they see with some of the individuals that we're helping in the community, if they are um, gaps in services, if we are oversaturated in different areas. So it's a very important way in which we are able to track what's happening um, with the health and welfare of individuals that are served through the hub. So as a certified community health worker, I see students from Cuyahoga Community College and also community members that may have issues or challenges in their lives. And if they do have those challenges, they come to myself and my community health worker students, which I'll talk about how they come to me in a moment. Um, they we work with them to connect them to resources. We help them complete applications. It could be a SNAP application, a WIC application, Medicaid application. We try to eliminate any barrier that they may have in getting what they need to ensure that they are um, able to take care of their health and wellness. So that is what I do as a community health worker. My other hat as a program administrator is that I help administer the training program for individuals that are interested in becoming a community health worker. It is a short term certificate, so you can do it in under 6 months. There is 106 hours of classroom training, which usually comes out to about 24 weeks of classroom training, and then there's 130 hours of clinical experience. So I alluded to earlier having community health worker students assisting me in the Pathways Hub. So that is an assignment that a few of our community health worker students have to get their 130 hours. They actually assist me in being community health workers and practicing those skills that they learned in class. They're able to now, in real life, utilize those skills under my supervision. So it's very important that as students are getting their 130 hours, they have the opportunity to practice the skills that they were taught during class. We also have an accelerated program that we offer several times a year, which is a day program. It's 2 days a week from 8 to 4:30. Those individuals are able to get through in half the time because they're spending 12 hours a week as opposed to 6 hours a week. Our typical program is 2 days a week, 3 hours an evening, and it's either 5:30 to 8:30, or in the summertime we do 6 to 9. We also have a class running now, which is 3 days a week, so they're actually getting 9 hours in a week. So they're able to get done a little bit sooner than those that are just doing it 2 days a week. Currently, because the Tri-C is part of a group of individuals and organizations that received a federal grant, we are able to provide those community health worker classes for free. It's covered under the federal grant. The recipients of the grant was Tri-C, Tri-C, Cleveland State, and Kent State as the training agencies, and you had all of the hospital systems here in Cleveland, major hospital systems, UH, Metro, and Cleveland Clinic. Metro being the leader, so they are the program um, administrator. So all the money comes to Metro, and then it is then shared with the rest of us. But because we did receive this 3-year grant, over the next 3 years, if you want to become a community health worker, you can come to Tri-C Cuyahoga Community College, Cleveland State, or Kent State and receive this training for free. The goal is to build the capacity of community health workers in the Cleveland area.
Well, I think it's very important, a couple of things that you're saying here. So you see a lot of places saying that they can't hire and people don't want to work. But I think it's the type of work that people don't want to do, the type of rules and restrictions that people are becoming intolerant of. And so, talk about, you all just got this grant, and you all were only supposed to do so many classes. But because so many people are calling and there's so much interest, talk about the number of classes you all are having, how many people are enrolling, and then another important element is you have people in other professions who are burnt out from their jobs. And so again, these jobs that provide this flexibility. Talk about how your program is growing at a time when a lot of companies and a lot of people, there's a lot of talk and chatter that people don't want to work anymore.
Yes, so we are seeing a lot of individuals coming into the community health worker field. The grant we received the grant in late fall, so we began in February, actually on Valentine's Day. We kicked off with 2 classes. One was that accelerated day class, another was an evening class. Our accelerated day class had 8 students. Our evening class had 21 students. We just started another class April 11th. We have 20 students in that class. We have a class that's starting June 26th. We already have 21 students enrolled in that class. So we are seeing a variety of individuals coming into the field of community health work. We have licensed social workers such as myself. You also have students right out of high school. You have We've seen nurses, LPNs and RNs come through our program. We have individuals that are just looking to um, have a career change. They're at their a point in their life where um, they want to change careers. So they are taking our classes. We also have individuals who say, I'm doing this all along. I do it at church. I help my family members. And now I'm hearing that there's actually a name for it. So I want to be certified. I want to be able to have that official title going along with the things that I love and I'm already doing.
Right.
So we see a lot of individuals that are really passionate about helping others that become community health workers.
And that's one thing I like about the program. One reason I like doing the show is learning about all of these organizations that are out here making a difference in the community. They're not trying to hold people back, hold people down while they take all of the resources at the top. And what flexibility, because that seems to be a very important thing. I think one, that time that it takes to complete the course. I think that you all having the option for people to do it in the daytime, for people to do it in the evening. I think when people know that, okay, it is 106 hours classroom and then 130 hours of actual experience. Because, I think the way education is has been done, it needs to change. And it needs to go more to this kind of model where, you spend all of this time going to college or school or whatever, and then, okay, now I got my degree, and you go apply for a job, now you don't have experience.
Right.
And so organizations and what a Tri-C is doing and what you do as a program manager is changing all of this. It's saying, no, we're going to give you both at a reasonable, fair cost that doesn't put you in all of this debt, and it allows you to, within a year, do the program and start and get a job and start working, right away. And so I think that that is something that's going to continue. I hear so many people talking about so many different entrepreneurial type things that people are doing to because they want to be in control of their own time. What flexibility does being a community health worker provide?
It depends on the organization that you work for. For instance, a Friendly Inn, um, they have a mom's first program, so they are out doing home visits with moms with young children. So some of those home visits may be in the evening. So there's evening hours. You have individuals working in a hospital setting. So traditionally it's 9 to 5, but you're also now beginning to see community health workers in emergency rooms, which are 24 hours a day. So that gives you that flexibility to do community health work in the evening. You also have individuals that own their own nonprofit that have been doing community health work, and now they'll become certified. They'll be able to go through the process to be able to bill Medicaid for some of the services that they're providing. So it does allow some flexibility in the work that you do. It just depends on the organization that you work for. So, for instance, my work at Tri-C, for the most part, it's a 9 to 5, but there are times when I am doing some work in the evenings because some of my clients are working or in school during the daytime. So, I'm spending some evenings connecting with them and making sure that they're following up with their doctor's appointment, reminding them that they have a mental health assessment. So it's really doing some hands-on and supportive work with those clients. So there is a lot of flexibility. It just depends on where you land as a community health worker.
Okay. Now, talk about like, nurses. Like I would imagine, when a person kind of first starts out, they may think like, is this my nurse? Or, What's the difference between what a nurse does and then what a community health worker is doing?
So a nurse is hands on. Community health workers, we're hands off. The only thing that we are allowed to do is to take blood pressure. So we can do vitals. So that is the only thing that we can do hands on, and that has to be under the supervision of a nurse. Nurses are all hands on. They're doing vitals. They're um, providing meds. They are doing medical assessments. We don't do any of that. We are the support. So if the nurse or the doctor or the nurse practitioner, for instance, gives their patient their discharge papers and they're saying you have to do X, Y, and Z, and they look at it, they're clueless. That community health worker, we're here to walk them through. Okay, Mrs. Jones, the medicine that you have you picked it up? No. Why haven't you picked it? I don't have a ride to the pharmacy. All right, let's check with your managed care organization. Let's check with your insurance and see if they provide transportation. Many of the managed care organizations are providing transportation. Um, let's get your medicine. So we get the medicine. We take a look at the medicine. I make sure that Mrs. Jones understands how to take her medicine. If it's twice a day, is it I'm going to take 2 pills in the morning, 2 pills in the afternoon, or am I taking um, a pill in the morning and a pill in the afternoon? So we're making sure that they understand, and it's called teach back. So we want them to tell us how you're going to take the medicine. Then it may say you need to increase your leafy green vegetables. So we have a conversation around, what are leafy green vegetables? Do you have access to leafy green vegetables?
Mm-hmm.
Many of our communities don't have grocery stores that have fresh produce. So how are we going to help Mrs. Jones get what she needs? Connecting her with food pantries, um, finding the nearest grocery store. Some of the managed care organizations will also take you to the grocery store. So you have to do the shopping yourself online, but they will take you to the grocery store. You do the pickup, and they put the food in the car or the van, whatever they're picking you up with, and they bring you back home. So though some of the managed care organizations are providing that service. It started during COVID, and they have continued to do that because it is helping some of our most vulnerable individuals be able to get what they need for their health. So with that discharge paper, we go through everything with that client to make sure that they understand what what was wrong with them. What is your diagnosis? Um, Hypertension. So you have to cut back on your salt. You've got to increase your leafy greens. You have to make sure you're taking your medicine. So we make sure that they understand what they're supposed to do, and then we check in on them to make sure that they're following the plan. So those are some of the things that a community health worker um, would do, for instance, that a nurse won't.
Mm-hmm.
So the nurse is just going to give them the paper. They may give them a quick overview, but then they're done.
Mm-hmm.
They're done. They're on to the next patient.
Mm-hmm.
It's the community health worker who is that long-term person that is going to work with that individual to ensure that um, they're healthy and that they are following the plan that was outlined for them by their doctor in this particular um, scenario.
Right. Yeah, I was reading that, like, even hospitals, I'm not sure why, but they don't do these type of services already, but they're recognizing that wow, these community health workers are doing something that we're not doing, and they're even leaning on organizations to come in and assist them with providing the services that community health workers provide that the hospitals don't provide. That's interesting to me.
Well, the hospital systems are beginning to hire community health workers. That's part of the federal grant that we received. So they are beginning to staff up. So Tri-C, as being one of the training programs, we're beginning to see, and our class started in April. We have several individuals from one of the major hospital systems in our class. So they're beginning to realize um, the value of a community health worker. So we're beginning to see some of those individuals. And the good thing is, if you're already employed at UH or Metro or Cleveland Clinic, um, and you're in a community health worker role, and now you're going to get certified, you can utilize your work hours as your 130 clinical hours.
Oh, wow. Yeah, yeah,
So
yeah.
that makes it, that's a great benefit for individuals that are already in the role. They can utilize those hours.
Yeah, that's really good. That's good. Yeah, because then that way you don't have to worry about, well, if I get out of here and go to school, where am I going to get a job at? And then with the flexibility of the course being in the morning, then it being in the evening, and then too, you can kind of say, okay, it's only going to be 6 months, it's of my time. Whereas most traditional degrees or programs, you're in them for a year or 2 years or something like that.
Right, yes, this is a
So
short term,
right,
short term certificate, and we help them. Part of my role is helping place them
mhm.
in those experiential um, clinical settings. So I have Tri-C has relationships and clinical agreements with organizations within the area where we then connect our community health workers, um, hospice, um, Care Alliance. I'm trying to think of some of the organizations that we have clinical agreements with. But there are a lot of community organizations that we have clinical agreements with that we place our students. Mary and Joseph's home, which is right next door to Tri-C. So we have a variety of places where we are placing our students, and that's part of my role. Is once they've completed, they have to complete a background check, a national or FBI and a local background check. Um, Once that's clear, they also have to meet certain health requirements. So you have to demonstrate that you are immune to um, measles, mumps, and rubella, Tdap, varicella, and making sure that your TB test is negative, and also during flu season getting a flu shot. So we want to make sure, and that's for your safety, so that you don't catch a disease, and also for the client's safety that you don't get someone else sick.
Right.
So those are the requirements that need to be in place prior to starting your clinical experience.
Yeah, it's a big nuisance when people come to work sick
Mm-hmm.
and they sit there and cough and hack all day, and you're just looking like, why you didn't stay home? When people feel bad like that. So, you know, I think that's one thing that COVID showed is be more cognizant of, the medical condition, medical environment that you're in, how it impacts the medical environment that you're in. And so, I think if nothing else, it kind of showed people, um, it was showing the difference in uh, how it affected people because of pre-existing conditions,
Right.
and so forth. Now, one thing that COVID did is it impacted the Medicare, Medicaid, and SNAP benefits, and so that's something that people should be aware of in this current environment, because that and what you just talked about, the background check. These are things that you should do before you get in the program so that you know and understand. Uh, you don't go through the program and then say, okay, I got to do a background check. When does the background check happen? And what are they looking at?
Well, they're looking at everything. In that background check, we encourage that background check to be done in the first 60 days. So 60 days after you start the program. The main offenses that
So you initiate the background check on your own, or does someone else, once you're in it, someone else says, we're going to do a background check?
On day two,
Okay.
day two of the class, I walk you through how to set up your, it's the American Data Bank Complio, which is the warehouse that you will be uploading all of your information into. I show you how to set that up. I give you time to set that up.
Okay.
And once it's set up, it will automatically, you'll load your packages, which includes that background check and a tracking system for the health requirements. We do that on day two. That way, you can within 2 or 3 days, because there's another safeguard where my supervisor signs off on it, and she usually does that within 24 hours. That will then automatically send you an email saying, "Hey, you are now eligible to go get your fingerprints done." I tell them where to go to get their fingerprints done. It's Fast Fingerprints. I show them how to get online, how to um, make their appointment. So within that first week, they should be making their appointment. And the appointment, you could put in your zip code and go to a Fast Fingerprints near you.
And that background check, it's a national and it's a local.
National and local. So there's FBI and also the local BCI.
Okay. Yeah. So that's important that people should know that, and then talk about if there is something that, so that people don't say, well, I got a felony or whatever, so I'm not going to apply for the program because that's going to come up.
Well, this is a certification through the Ohio Board of Nursing, and Ohio Board of Nursing does offer a I guess, check of an offense. So if you do have an offense that you think may be a disqualifier, you're able to complete an application. There is a small application fee. You complete that through the Ohio Board of Nursing, and they will go through your background. You let them know what it is, and they'll let you know whether or not that is a disqualifier. So you can do that early on, even before you enroll in the class. You can walk through that and make sure that your felony or is not a disqualifier. So that's something that would be being proactive that you would do prior to, so that you're not wasting your time, being in the class and then find out that you have a disqualifying offense.
Okay, and so if you have that disqualifying offense, do they help you get through that so that it can be removed, expunged, or?
Well, we can connect you with a community health worker that will then let you know about any of the expungement clinics and things like that that they can go through, or connect them with legal aid to see if there's anything that can be done about some of those offenses. And so that is another uh, role of a community health worker. So we could connect that individual with a community health worker, potentially someone at Tri-C's hub that could work with that individual to see if there's anything to do about expunging it or getting it sealed.
Okay. Okay, yeah. So that's good though. People should know that you get in stuff and then you start and then you start saying, "Oh, well, I didn't know it had this component to it," or "Oh, I'm not prepared with that," or "I don't want to give out this information." And so it's good to know that there's a background check. It's a national one. It's a local one. So definitely when you get into a national one, they can get very detailed. Start asking for a lot of information and start asking for a lot of documentation to support what you're saying too. And so you may have to go off and get documents. Do people sometimes have to do that?
No, it's fairly simple. It's going off your fingerprints and your social security number.
Okay. So that's good. Now, one thing you talked about is um, that students, you all help them with your partnerships get jobs. So if you have people right out of high school, if you have nurses, how do you all know what they want to do. Do they already know, or as they go through the class, do they start saying, okay, I think I want to go in this direction, this direction?
Yes, so it's going through the class and really finding what your where your passion lies. When you do your 130 clinical hours, it has to be across the lifespan.
Okay.
So you have to have the opportunity to work with mom and children, adults, geriatrics. We put you in different environments working with Western Reserve. We'll connect you with maybe Care Alliance. So we want to make sure that you have a variety of opportunities through your 130 hours so that you can really get a feel for what your where your passion lies, what's your niche. Some already come knowing
Right.
I want to work with children.
Okay.
I want to work with the elderly. So they already know where they want to work. They still have to do their clinical hours across the lifespan, but they already know I want to work with with babies. So they already come. Some come with that knowledge and passion, already, but some need that experience to be able to figure out, what population they want to work with.
Now, what about if I want to start my own nonprofit organization to be able to provide the services to people that community health workers provide? How does that work? You know, so if I set it up, then how do I get clients? What happens? Is there something to help you do that, or?
Well, there's nothing that through our program that would help you do that besides the certification. In order for them to be reimbursed by through Medicaid, they do have to be certified.
Okay.
So they can then work with Medicaid to be able to um, be a provider. And once they're providing those services, then they can seek reimbursement from Medicaid.
So are there people out there that help you, or does Medicaid or Medicare help you through that process? Because again, sometimes when you start dealing with the government, you have a lot of forms to fill out. And so if you want to start your own nonprofit organization doing this, because like you said, you all work with different organizations, and these organizations have been doing this stuff for a long time though. And so then they start picking this up and they get the license, community health workers and so forth.
Yes, but the only thing I can think of in terms of help would be some of the organizations like the Cleveland Foundation that will help they do help with nonprofits getting off the ground. Neighborhood Leadership Institute, some of those organizations have workshops on how to get a nonprofit started or supporting a nonprofit that's brand new. But that is besides getting that certification through a Tri-C's community health worker program, um, there we don't provide any other resources at this time for new and upcoming organizations.
Yeah, I just wonder, with there being, this is, seems like it could be one of those industries or professions where so many people start getting in there. For one, there's definitely a big need for it.
Absolutely.
People that care about their community, and so that means I want to be in my community and connected to my community. And then, as long as I'm providing the community health worker type services and have that relationship with my community, maybe I want to do it this kind of way. And so I think the more of these organizations we have, the better, because they can service more people, and you don't have to go through, going through the hospital and making an appointment. And like a lot of these, when you make a medical appointment now, it's almost like you're lucky if you get in 30 or 40 days. And so it'll be interesting to see, with how much that grant was, because it was like 30 million across the country, right? That the federal government gave out, and so and then like I said, the way your program is just, is accelerating. People are signing up for this program, and so it'll be interesting to see how many people say, no, I just want to sit here and serve my community, and start their own smaller organizations and kind of grow from there to be a resource for the community, because we live in these communities and you can see this stuff every day, that people need services, and you know if you learn this stuff or you're aware of it, helping your community, I think that that's just a big thing that a lot of people are looking at doing now. Small businesses, how can I just do commerce where I live at? Everybody doesn't have this desire to be on this national or international level, So, like I said, when I first saw this program about 3 years ago, I was just like, wow, I've never heard of this. This is a really unbelievable program. Um, Now, one thing I was looking at on your website is, again, the diversity of jobs that you all have offer that people can apply for.
Mhm.
So you don't have to just go and look for all of the jobs yourself, right? You all have a lot of jobs across, like we're in Ohio, Northeast Ohio, like Eliza Jennings, University Hospitals. Uh, you all have positions for like open instructors. How often do you all seek instructors?
Well, with the way that our the growth in our classes, we are rapidly seeking instructors. So, with the increase in the number of classes that we're teaching, because there is a demand, we have people calling up and asking for classes, organizations calling, asking for classes, and so we need more and more. We will need more instructors, because as of now, we had two classes running well, we still do have two classes. At one point, we had three classes running at the same time, and so we all can't be, in three places at one time. So we recently just hired one of our graduates as an instructor. So he just started with us with the our April class. He just started with us. So we are grooming our own in a sense. So, he was an excellent student, and he is a community health worker at one of the hospital systems, and now he, part time is an instructor for us. So, that need is out there. We also have organizations that will come to us and say, hey, can you get this job opening out to your graduates? We have two openings, one opening, and we get those out to our graduates. I actually just had one of our community health worker students, just as she was finishing up her 130 hours, she applied for a job that we had sent out to our students, and within, I'd say, 2 weeks, she got that job. So she just started about 2 weeks ago um, at an organization, and that was through a post that we put up saying, hey, here's some open jobs, and she applied and she got it. So we work with our community partners, as they have openings, we make sure that our graduates know about those openings so that they are not open very long. And we hope that our graduates are able to assist these organizations and fill the void that they have.
One word that I hear a lot about talking with a lot of people that are doing in the health care, health industry space is social determinants of health.
Mm-hmm.
So, you know, what does that mean? Because people may be experiencing that or have experienced that and don't realize it.
So, the social determinants of health is the um, environment in which we live, breathe, eat, and sleep. So, these are also modifiable things. And so, let me just give an example. So, um, a social determinant of health is your built environment. So if you are living in a space that has mold and um, lead,
Mm-hmm.
that is not safe for you and your family.
Mm-hmm.
that location, that if that's something that can easily be modified. Most of our social determinants of health make up 80% of healthcare. 20% is going into um, the doctor's office. The other issues come from those modifiable risks.
Wow.
So, in certain areas, the social determinants of health, there's a great disparity. So, there's a great disparity between the number of black babies that die than white babies. Um, Research has shown that there are more white babies born, but more black babies die.
Mm-hmm.
And so we have to look at why.
Mm-hmm. Mm-hmm.
And that is part of social determinants of health. So why are the black babies dying? Is it the health care? That's a social determinant of health. Is it the health care that you're receiving? One of the Williams sisters,
Serena.
Serena, who her and her baby almost died. And she's well known. And I'm sure she was getting good, she was at a nice facility, but they overlooked her. They didn't hear her voice because of the color of her skin. So there are great disparities that we live with, and community health workers are trying to close those gaps. So in our previous example with Miss Jones, if she's living in an environment where there are no grocery stores and she can't get fresh fruits and vegetables, how are we as community health workers? That's a modifiable risk. All you have to do is be able to have access to it.
Right.
She doesn't have access. And you think about moms that have 2 or 3 babies, and they have no grocery store in their neighborhood. I think of our central neighborhood. Dave's is gone on 40th. So they have to go all the way down to 65th and Payne, where the new Dave's is. And if you are on the bus with 2 children, 1 children, or on the bus by yourself, and you have to go shopping for you and your family and carry all those bags, that's a lot. And so what happens is you just go to the mom and pop shops right in your area, you get the food, but it's the food that's not as healthy. So as community health workers, we also advocate. We also help the community advocate so that they can get what they need for their community. Our community health workers are boots on the ground. They know their community. You were talking about that earlier. Being there for your community, that is the core, that is the heart of being a community health worker, is helping your community. And so these social determinants of health, in some areas, there isn't a disparity. And there's equitable access to to education. Their built environment is so that they are not dealing with mold, and they're not dealing with lead. They have green space to exercise and to walk and to be outside safely. So those are, I could probably go and talk for hours around those modifiable risks. The key is they're modifiable, but for some areas and for some people, it's very difficult to navigate because of the community in which you're in. So our community health workers try to mitigate those barriers and help their clients, the people that they're serving, their community, get access to what they need, whether it's education, whether it's training, whether it's medical care, whether it's groceries, to help mitigate those social determinants of health.
Now, one thing I'd like for you to talk about a little bit is what you actually teach in the class. Because if I'm a student like, okay, I want to do community health worker. I want to be a community health worker. And so then I said, okay, I'll get in this program. What am I going to learn? Because this isn't like the traditional type of learning where maybe go get a degree in history or something, or science or something. This is you all are actually bringing in people who actually do this work. And so they can give you the real life examples, like what you were just saying, the social, I can go on forever about social determinants of health. So you're having people with actual real experience because that's the thing about you. You are a licensed social worker and you are a licensed community or certified community health worker. And that's different from sometimes you have professors or instructors or teachers who that's all they do is teach. They don't have real world experience. So talk about some of the things you all do. So when you say that, well, you have these social determinants of health, and so we help people do this, but you're able to help them because during the classroom, you all tell them what those resources are.
Yeah, so they are learning from day one what a community health worker, um, what community health workers do. They're learning about social determinants of health from the very beginning. They're learning about public public health, and they're learning about upstream and downstream. So when there's issues, we want an upstream approach because we want to stop it before it happens. So when we look at these social determinants of health, we don't want them to happen anymore. So we have to go upstream and figure out what's going on. So one of the examples that we utilize is um, some people walking through the woods, and there's a creek, and this individual keeps washing up, and they're pulling this individual out of the creek. Um, and it happens again, and the group's pulling this person out of the creek, and it's happening again, pulling the person out of the creek, and someone says, "Let me go up there and see what's happening.
Right.
Let me go upstream."
Right. Right.
So they went upstream. It's a beautiful place to take a selfie. So they're turning around and taking selfies, and someone's falling down into the creek. So an upstream approach would be put plexiglass up there, put some type of barrier so that individuals can still take pictures, but they're not falling down.
Right.
That downstream approach is the band-aid. We're just pulling them out of the water, but we're not looking to see what the problem is. So we teach them about being proactive and looking for upstream approaches. Um, we also have nurses that come in and teach about chronic conditions. They do a little bit with anatomy and physiology so that they know some of the basics.
Right.
All of that has to be taught by a nurse, a registered nurse. The nurse also teaches them about vitals, and and one thing I haven't mentioned this whole time is that our classes have been virtual since the pandemic. We tried to have an on-site class and nobody signed up. So our classes are virtual except for 2 labs. You have to come in for the to learn how to do the blood pressure and take vitals, and you also come in for CPR. Those are the only classes that you actually come on campus. Um, we did have a request to do a on-site class, so we're looking at doing that in July, an on-site class. So there's portions that are taught by the nurse. The other portions have to be taught by individuals that are subject matter experts in that area. So that's part of my job as the program administrator is making sure that the instructors that are coming on board have that subject matter expertise to teach that subject matter. So we also look at teaching about the lifespan. So we go from conception to geriatrics. And that's actually one of the areas that I most often teach with my early childhood and social work background. We talk about target populations because different populations you're going to have to approach them a little bit differently.
Right.
So we've talked about homelessness. We've talked about individuals that are coming back to the community after being incarcerated. We talk about individuals with HIV. We've just recently added um, the gathering place. So they come in and talk about how to work with individuals that have been touched by cancer. And we switch it up because there's not enough time to do all of the target populations. But each one of those populations, you have to approach them differently. So we talk about what is unique and different about those populations. And then two things that I love to do with them are role plays.
I was about to ask.
So we do role play so that they have the opportunity to practice those skills, practice those interviewing skills, those client centered questions. So we have them practice that. And the other thing I'd love to do with them is we play Kahoot. So that's a little online competitive game, but it allows them to learn the content in a fun way. Um, what else do we do? There's so much.
Talk about your resource information so that if I'm a community health worker, this person needs this, I know they need it, but how do I help them get it? Talk about the resource information so that you're prepared again on day one.
So one of the day two, they get this assignment. They have to create a resource guide. So we give them a whole list, and it's a lot, of needs that an individual may have. And they have to go and find resources in the community. Um, it could be a national resource. It could be Summit County, because sometimes you're working with an individual, for instance, that might be going to Tri-C, but they live in Summit County. So,
which is about 40 minutes away.
Correct.
Yeah, so you're in a different county.
You're in a different county. So we encourage them to look for surrounding counties, Cuyahoga County. Maybe there's a national resource, especially dealing with medicines. So providing, working with actually talking with some of the, not medical providers, but the pharmaceutical companies to see if there are ways in which there's discounts available. So we really want them to think outside the box, and they have to have 3 to 4 resources per area.
Oh, wow.
So if it's low cost medicine, then they have to have 3 or 4 resources. So this provides them with a foundation to have resources available day one.
Right.
The other thing is throughout the class, we're doing exercises and activities where we're asking them, you're in this situation, go find some resources. And I always tell them, listen to your classmates, because each group is going to come out of the breakout room with different sets of resources. Write them down. As a community health worker, still learn from my students. And I'll say, oh, I didn't know about that resource. So I'm writing that down. So we learn from one another. You know, we are colleagues. And, you know, it's important to share those resources, and we talk to them about vetting the resources, especially now that we are, you know, when we went into COVID, now we're coming out of COVID. We have to make sure that those resources are still open and receiving new customers, making sure that we know what the criteria is so that we're setting up our clients for success, letting them know you're going to need to take your social security card and your birth certificate in order to get XYZ. You know, enrolling in WIC, you've got to bring, you know, your proof of pregnancy, birth certificate, child's birth certificate. You know, if you're going to put a newborn or, you know, a 2-year-old on WIC, you need some of that information. So we also talk to them and have them practice vetting resources and what a good resource looks like. So we do a lot of work around that because we want to make sure that when they are done with our program, they know how to um, go out and well, actually have resources at their fingertips, and then go out there and find resources for their clients, and know that they're good resources.
So when you have someone that is using a community health worker, do they realize that they have a community health worker and what the community health worker will be doing and helping them with? Because again, I'm trying to make sure that that distinction between a nurse. And so when you're in a facility and you're going to be assigned, or a community health worker is going to be overseeing your care or your health, is the individual that's receiving it aware of it, and how do they come in contact?
Usually that is a referral from, if they're
Okay.
in a hospital system, it's a referral from the doctor or the nurse um, to have that community health worker follow up, maybe even
Okay.
going over the treatment plan and then following up with them. So usually, at a hospital system, you're getting referred a person for the most part. Um, Community health workers are get referrals
Okay.
for the most part.
Okay. Now, one thing, you all have a list of learning outcomes that that the community health workers are, that you all expect or hope that the community health workers will learn. Two of them that I think is important is communication and safety. So, again, how does that work when you're talking about, okay, I'm in this community, and how do I communicate with this person, the people here? How do you all teach the students on how to communicate with the people that they're going to be working with?
We have actually, she's a licensed independent social worker that teaches the students about motivational interviewing and client centered and strengths based
Okay.
interviewing. So they have 6 hours of class time where they're learning these interviewing skills and why it's important to come from a strengths based approach and also to be client centered, because we come in with our preconceived notions that a client needs X, Y, and Z, but that client may not um, see those same needs. The client may also um, have different priorities.
Yep. Yep.
So you have to work with where the client wants to start.
Okay.
We also teach them about having, and usually I'm on camera when I do this. We teach them about having big eyes, so you want to observe, big ears, you want to listen, and a small mouth. So you don't want to do most of the talking.
Right.
You want that client to be talking, but you want to make sure that you're watching, you're looking at body language, you're looking at environment, you're listening to what the client is saying, and then you are just putting the pieces together. You're not doing all the talking. So they spend, like I said, 6 hours learning about motivational interviewing, role playing, the importance of being client centered and following that client's needs. So that is, and it's done by, like I said, a licensed independent social worker. So she's an individual that is a subject matter expert.
Okay. And so again, I think we're getting into this environment more and more where people, whether it's the pandemic, jump started this, or however, we're getting to a place where more and more people are realizing, I'm going to do with my life what I feel like is my calling, or what I've been wanting to do for years.
Mm-hmm.
So talk about your background as a licensed social worker, and then how what you did as a licensed social worker, why you started in that field, and then how you migrated to the community health worker profession.
Oh, wow. Um, I guess in the beginning, I really wanted to be a judge. And that was because I was very interested in why criminals do what they do.
Ah, okay.
So I fell into um, psychology because I ended up saying, no, I'm not going to law school. Psychology and education. So I was a certified teacher 7 through 12 in Ohio, South Carolina, and also Michigan. I've been a teacher, I've been an administrator. Um, I've also been in the field of social work. So I did work for the Department of Children and Family Services for a while. I worked for a small um, private foster care agency. I found myself at a large social service agency here where I worked with the Head Start and Early Head Start program. Actually, had the pleasure of running the very first Early Head Start program in Cuyahoga County back in 1998. Um, so I was in that social work education field, always helping. I'm a servant leader, just always working with individuals, and I always found myself working with the most vulnerable populations. Most of my work um, has been done in the Midtown Central area when I look back at my over 30-year career. I left for a while. My family and I moved to South Carolina. I was in the school system down there. I was a school social worker. So, I was out and about in the community making sure that the students and their families had what they need. Ended up in the classroom teaching in a alternative education program, and we decided to come back home. Started working for another large social service agency that was opening up a charter school. So I was the founding assistant principal for that charter school. And what drew me to that is it was based on helping the whole child and helping the family. So doing a 360 wrap around that child. So that child comes to school to learn, but we also have to look at their social and emotional needs. We also have to make sure that the family has what they need in order for that child to be successful. Because we only have that child 6 hours a day. They're going home.
Right.
So we did a 360 of wrap of that child and the family. So that's what really drew me to um, that that school. Um, because again, I'm helping people.
Yes. Yes.
I left that organization. I did that for a while, and then I went back and I was managing their child care facilities. Um, and then had an opening at Tri-C as the program manager of the Upward Bound program. During that time, I had the opportunity to meet Marquita Rockamore, who is the director of Health Industry Solutions, which the Community Health Worker program falls underneath. And she told me about community health workers. I'm like, that sounds like me.
Wow.
That sounds like me. It's different than what I've done as a social worker, but there are some similarities. And she asked me to join her in taking the class. So I actually went through the class with her. She brought me on board as an instructor, and then eventually I moved into the program administrator role. That was all part time. Um, and really just helping her with the curriculum and making sure our curriculum was the best curriculum it could be. There are standards that the Ohio Board of Nursing has outlined that these are all of the things that you have to have in your curriculum. So we have that and more. The Ohio Board of Nursing says you've got to have 100. We have 106 because there were more things that we felt that needed to be covered to ensure that we are doing justice for the community that we serve in Cuyahoga County. Um, from there, they were awarded Health Industry Solutions Tri-C was awarded a grant to stand up a community care agency and be part of Better Health Partnerships Community Pathways Hub. And I left my position with Upward Bound, and now I'm full time a community health worker, making sure that our students at Tri C, their families, and the community that surrounds Tri C, making sure that they have what they need to be successful. And so it seems like that is the story of my life, is making sure that individuals have what they need to be successful. And if they don't, I'm trying to help them get it.
Yeah, and like I said, that's why I started BlackAnthropy, because I think that there are so many people out there like you doing this kind of work, and we don't hear about it enough. We hear about a lot of divisiveness and what is not going on, what is not happening, but we do not have enough information about what, people really need. I think if people, like the services that your organization, that you all teach people, you all are providing people knowledge.
Mm-hmm.
You all are providing the community resources.
Mm-hmm.
You all are providing people opportunity to start a new profession, enter a new profession, expand their knowledge, and then it's like that's inspirational to people that wow, I can change, I can do this. I don't have to go through this very, complicated process to be able to do it. And I think that, when we talk about celebrating Black History Month and certain holidays, we're still talking about what was done in the 50s and the 60s and years and decades ago. And I think that we're just missing so many people in between, and we're not focused enough on what people are doing now.
Mm-hmm.
And it's almost like, when they do bring someone on to talk about, um, you know, like what you're doing, they'll say, well, we'll just have one person a month or something like that. Constantly putting that positive information and energy out there, I think, is what is going to help society make this shift and put all of this divisiveness to the back burner.
Mm-hmm.
Because, again, for being inspiration, when people realize that they can learn something new, they can do something different. And I don't have to, do this path that I thought I had to do. I can create my own path, and it doesn't take me a lot. I don't feel locked into it. I mean, like, I couldn't believe, was it last week or 2 weeks ago, listening about the student loan debt, and students saying that why they wanted or prior students talking about the importance of having the debt extinguished, removed, all of it, a portion of it, or whatever the case may be. I mean, and to listen to people say $300,000 in debt, I couldn't even believe my ears.
Yeah.
To say that you marry someone and now we're both on the hook for this debt, even though mine is maybe 0 or 10 or 20%. And so I think we've got to get more information out there about organizations like yours. It's $2,500. It's being paid for. It's being sponsored. You're going to get real hands-on experience that you can use right away.
Right. And the only requirement, there's two requirements that, well, I'll say three requirements that you have to have in order to um, enroll in the community health worker program. You have to be 18. You have to have your GED, adult diploma, or diploma. You have to be able to pass the background check. Those are the only requirements to become a community health worker. And one thing that you were talking about, celebrating Black history, do want to say that last year, Governor DeWine um, made June 6th National Community or Ohio Community Health Worker Day. So tomorrow is June 6th, so we will be celebrating community health workers. We're having a luncheon and celebration at Cleveland State. So we will be celebrating all of those community health workers that are those boots on the ground individuals in the community doing the work.
Yeah, so that's awesome, because again, we need more information out there like this. We want this to be inspirational for other people to start organizations like this locally, nationally, and people be able to say, if they go to Summit County, if they go to Franklin County, if they go to another state, you all have community health workers. I need this, or this. And so I think that, more organizations like this are needed, doing that teaching, getting people, making those partnerships, establishing those partnerships, and then making it easy for people to find a job. Generally, yeah, when you graduate from college, you know, yeah, they have some jobs, but the way you all do it is like part of the program is that you all try to ensure everyone who comes to the program gets a job, or
They're aware of the openings and that exist in the community. We're linking them to it. All they have to do is apply. So we can't make them
I
apply,
hear you.
but we're going to make sure that we get all those openings in front of them.
Right, right. Okay, well, I want to thank you so much, Malek King, for being on the show today. That's so much great information, so much information that is helping the community, that the community needs to be aware of when they are faced with these different challenges. They recognize that maybe I can call and see if, you know, uh, this organization can help me, because you all are resource intensive. That's what you all do, are in the business of providing resources to people. So uh, that's going to be it for today. Uh, Thank you all so much for listening in. Thank my guest, Malad King, for coming in and telling us about the community health worker curriculum at Cuyahoga County Community College, Tri-C, here in Northeast Ohio, and sharing a lot of really good information with us. Um, Thank you very much. Until next time, I'll talk to you later. You want me to read this now?
Mm-hmm.
Has violence happened to you or your family? Violence can affect all parts of your life, sometimes in ways you can't see. Violence can affect the way you eat, sleep. It causes you to lose focus, feel angry, afraid, use drugs or drinking as a way to escape. Violence doesn't have to keep hurting. You can change your life starting now with help from a trauma recovery center. Take control of your life. Today can be the day. The Trauma Recovery Center offers real hope for real needs in real time. They offer services for safety, emotional support, food, clothes, and more. Don't let violence control you. You can break free, and TRC can help. Call the Trauma Recovery Center at area code 216-644-5487. They will come to you wherever you are. Call today. It's 24 hours a day, 7 days a week. They can give you the tools to rebuild your life and your health. Call today. It's free, 24/7 and confidential. If you want out and don't know where to start, call us. The Trauma Recovery Center can help you take back your life after violence, starting today. 216-644-5487. Coffee. This is BlackAnthropy, and we'll be right back.
That was awesome.